Okay, this video is called Common Things Doctors Don't Know, But They Should. First of all, tap water is full of toxins. Fluoride is rat poison, okay? It's toxic to your gut wall, causing leaky gut, increased intestinal permeability, which makes your blood more likely to clot, so you can get heart attacks, strokes, hypertension. It's also toxic to your gonads, your brains, your ovaries. Lowers IQ, toxic to your bones, skeletal fluorosis. Aluminum is used as a water clarifier. It's toxic to the gut wall, leaky gut, toxic to your gonads, lowering sperm counts, toxic to your brain, lowering IQs, causing cognitive decline. F- and Al form a complex together, increasing traversal of the blood-brain barrier. You'll see fluoride on most of these neuropsychiatric medicines. Look at Prozac, it's called fluoxetine. Look at fluoroquinolone antibiotics, they're called fluoral. That's because there's fluoride in them, okay? Aluminum is also a metalloestrogen. It's in the deodorants, and so it gets into the armpits and goes right into the upper outer quadrant with shared lymphatics with the breast, increasing the risk of breast cancer. Upper outer quadrant breast cancer used to be 25% in the 1920s. Now it's 60% because of aluminum deodorant. You know, pretty stupid, and a lot of people shave their armpits. You don't need deodorant. It's for conformist, low IQ chumps. Okay, by the time somebody's got their nose in your armpit, they like you, okay? You don't need that crap. When you walk in the door, you say, hey, how you doing? You don't sniff each other's armpits like a dog. Okay, tap water is also full of estrogenic chemicals, things like the plastics, like BPA, bisphenol A, and phthalates and whatnot, which are estrogenic, not to mention other estrogenic chemicals. High-fat diets increase the risk of leaky gut. You know, they're totally freaking stupid. And so do high-protein diets. The high-protein, the nitrogen is taken by the bad gut bacteria. They convert it into ammonia. The ammonia then is basic, so it raises the pH of the feces in the colon. That kills off good gut bacteria. You need the good gut bacteria. They're the ones that make short-chain fatty acids. Good gut bacteria, they eat fiber, so you want to eat plant foods. There's no fiber in meat, there's very little in processed food. They take it out of the processed food because it makes it spoil faster, because the bugs want to eat it because it's good for them. Okay, so anyways, good gut bacteria eat fiber. You only need to know two types of gut bacteria. There's good bacteria that eat fiber, and there's bad bacteria that eat other stuff, okay? They convert the fiber into short-chain fatty acids, and that maintains the gut wall. Some of the short-chain fatty acids, in particular the butyrate, goes up to the brain through the blood, and it's used to maintain your blood-brain barrier. So it keeps you smart. It keeps you thinking clearly. And, you know, the average doctor doesn't know anything about nutrition. They don't know the basic, simple fact that the best treatment most of the time for obesity, hypertension, diabetes, coronary artery disease, back pain, and many other conditions is just a low-fat vegan diet. Low-fat vegan diet optimizes blood flow, optimizes immune function, and should be 100% vegan. You actually can do pretty well if you're just 90% vegan. But it should all be, you know, low fat, no oil, no caffeine, no sweets, no alcohol. All oils are bad for arteries, including olive oil. Omega-3s are not healthy. They increase the risk of prostate cancer, atrial fibrillation, immune compromise. You get enough omega-3s just from eating low-fat plant foods. Atherosclerosis, which is caused by these bad diets, standard American diet, the high-fat, phony Mediterranean diet, that's about 40% of calories from fat, as well as all this paleo keto nonsense, which is just to trick the pros, the chumps. Anyways, it plugs up arteries all over the body, causes all kinds of problems: vision decline, blindness, impotence, hearing loss, AFib, atrial fibrillation, congestive heart failure, cognitive decline, dementia, etc. Doctors do not know nutrition at all. They don't know epidemiology, and they don't know toxicology. And these are the most important things for health. So really, doctors don't know much about health. I could train anybody. You could train a high school student, could spend 1 week watching my YouTube videos, and they would know more about nutrition, epidemiology, toxicology, and how to treat the common Western diseases than a doctor will after pre-med, med school, residency, and a fellowship. You think I'm joking? I'm not. I've had doctors come to me all the time, and somebody like will shadow me for a day. All they got to do is hang around with me about 2 hours, and they will learn more than they learned all through pre-med, med school, and residency. It's true. You can tell. Ask any doctor to watch my videos and ask him if he doesn't learn more in 1 week of watching my videos than he did in the rest of his previous education about the most important health topics: nutrition, epidemiology, toxicology. And, you know, you should know some lifestyle stuff, like how can you improve sleep, how do you manage stress. You know, religious people are much healthier. Having a sense of purpose makes a person happy and healthy. Getting your sunshine, biophilia, you know, the benefits of social interaction like the Rosetta effect. UPFs means ultra-processed foods. They're high in sodium, And they typically have toxic preservatives, things like succinate dehydrogenase inhibitors, SDI, mold inhibitors, okay? And those things are mitochondria inhibitors, okay? They sap your energy. UPF eaters, they're usually fat. Look at Nauru Island, look at the Marshall Islands. Anywhere people eat a lot of processed food, they're fat and sick, hypertensive, diabetic, coronary artery disease. They have no fiber, hardly any, so they get abdominal pressure syndrome, which just means all the back pressure from straining at the stool when you're constipated. Because fiber pulls water into the stool, makes it bulky, and makes defecation effortless. Dried out stool from constipation and lack of fiber makes your poops like goat pellets. And then you have to tighten your abdominal muscles to defecate because you're not stretching the rectal wall to get that effortless reflex contraction. So anyways, abdominal pressure syndromes, all the back pressure things like hiatal hernia, gastroesophageal reflux, and all that stuff, diverticulosis, diverticulitis, and all that stuff. It's easy to improve blood flow and immune function. Just eat the low-fat vegan diet. Average Westerners only eating about 10 grams of fiber a day. They should be eating over 40. Fiber prevents abdominal pressure syndrome. If you're just changing your diet, you want to go a little slow because you don't want to overwhelm your gut with too much fiber at once. You have to gradually let the good gut bacteria build themselves up, okay? A lot of people say, why do I get gas and bloating? And well, the reason is they're usually eating sort of a half-butt diet, 50-50 if you will. They'll be eating meat and processed food part of the day, then whole food, plant foods in the rest of the day. So there's constantly a turf battle between the good and the bad bacteria. One of the nice things about being 100% vegan is the good bacteria are in charge. There's not this constant back and forth turf battle because when you eat the good food, you feed the good bacteria. When you eat the bad food, you feed the bad bacteria, okay? The fiber attracts water to the stool, and your colon hangs on to that stool until your next time when you're going to have food and water available. So if you only eat one meal a day, in a sense, it'll hang on to that stool, which is a little bit wet from the water attracted to it by fiber, and it's like a camel's hump. You'll notice if you don't eat or you don't get home until late, you'll hang on to that bowel movement until later, and it'll be drier if you're home later. So what I'm saying is it's a water reservoir for your body, like a camel's hump. That's one of the beneficial things the colon does for you. The more fiber you eat, the bigger your bowel movements will be. Instead of looking like goat pellets, they're going to look closer to being like a cow patty or a swirly. Okay, you want to start? Okay, we talked about that. Fiber lowers the risk of the common Western diseases, including, all the stuff we talked about, hypertension, diabetes, obesity, but also cancer of the colon, breast cancer, prostate cancer, etc. One of the reasons why it lowers breast cancer and prostate cancer is it helps to sweep estrogenic chemicals out of your body. Normally, when the body has an excess of estrogenic chemicals, they're excreted by the liver, they're conjugated, like let's say with glucuronic acid by the liver, and then they're defecated out of your body. But if you don't eat enough fiber, then you get bad gut bacteria, and they'll have an enzyme, glucuronidase, which unconjugates the estrogenic chemicals, and they get reabsorbed back into the body. Higher fiber also helps to sweep cholesterol out of your body, lowering your blood cholesterol levels, which is good. Fiber lowers colon pH, makes it more acidic, and that's because through anaerobic metabolism, it converts fiber into short-chain fatty acids. And that acidifies the colon contents, which is good because that favors the growth and development of the good bacteria. We talked earlier about the problem with eating high-protein diets is that the nitrogen gets in part converted into ammonia, which is basic, raising the pH and helping to kill off the good bacteria. Okay, the fats, intrinsic fats, are toxic to the gut wall just from being fat. Okay, epidemiology makes it obvious that low-fat plant-based diets are the best. A billion out of a billion rice eaters are skinny because white rice has only 1% of calories from fat. Back in the day when they ate over 80% of their calories from fat, like Japan and China, for example. In Okinawa, they were a little healthier than the regular mainland Japanese. I think the main reason is they ate much less sodium. They also ate a good amount of sweet potatoes. You can look at any epidemiology story. The low-fat plant eaters are always the healthiest ones. Look at the Tarahumara from northern Mexico, Copper Canyon area, Sierra Madre Mountains. Compare them to the Pima, who they were split from in 1848, Mexican-American War. Pima absorbed into Arizona. Nowadays they eat the SAD diet, standard American diet. They're all fat and sick. Look at the Finland story, Pekka Puska, Dr. Pekka Puska out there in the 1970s switched them to eating much more plant foods, much less dairy, and lowered their fat content and had dramatic improvement in their health, 87% risk reduction in coronary artery disease. Japan migration studies. The more the people went from their old-fashioned Japanese diet with rice and veggies, especially as the staples, the fatter and sicker they got as they westernized. Look at Africa. Back in Kenya, 1929, Donaldson paper, Lancet Journal, 1,800 consecutive admissions to the hospital, adult black men. Not a single patient had hypertension. In the USA, that'd be 80% because a whole food, plant-based diet prevents hypertension. So all the stuff about genetic salt sensitivity in blacks, it's all BS. It's just a way to sell more drugs, okay? They don't have any hypertension when they eat a healthy diet. None, zero. In Uganda, it was a 1960 paper in the American Journal of Cardiology, 1,427 autopsies of patients in Uganda. Not a single patient died from a heart attack. These are adult men and women. Not a single death from heart attack. Okay, in the USA, that'd be a giant percentage. And that's what I mean by it's not like a close contest between low-fat plant-based diet versus these high-fat modern diets. It's 100-0. The low-fat plant eaters, they don't get the common diseases, obesity, hypertension, diabetes, coronary artery disease, atherosclerosis, plugging up arteries in the heart, the brain, the Johnson, everywhere else. They don't get these diseases. It doesn't get any better than that, 100-0. I mean, I tell people, look, if you don't understand 100% success versus 0% success, I can't help you. Go somewhere else. Go to the witch doctor. He'll do a rain dance for you. I'm sorry, but if you don't get that, there's nothing I can do for you. All right, let's see what else. Rheumatoid arthritis. There was not a single case reported in Africa before 1957. Roy Swank went to China around 1960. They couldn't find a multiple sclerosis patient. There's tons of them in the USA. Blacks in the USA have tons of autoimmune disease like lupus. They have hardly any of that, if any, of these diseases in Africa when they're eating a plant-based diet. It's easy to improve sleep if you know how to exercise and increase adenosine. You understand the basics of red and blue light and circadian rhythms and stress management. Oh, another thing is most dental procedures are toxic to health. I wrote a book on that. I give a whole bunch of lectures on it. But I'm just saying is do not go blindly into a dentist's office. It's a dangerous place. So anyways, these are all common basic things that are extremely common. I see these diseases all day long. Almost all people in America, as they get over 50, they've got hypertension, prediabetes or diabetes, leading to atherosclerosis, coronary artery disease, plugging up arteries all over the body, leading to heart attacks, cancer, stroke, AFib, etc. And they're totally preventable diseases. Basically, in the third world countries, a lot of people die from infections, but we can prevent most infections in the first world, second world, if you will, America and Europe, because we've got antibiotics, we've got indoor heating and plumbing and sanitation to prevent those infectious problems, and we've got, low-fat vegan diet to prevent all the Western diseases. So if you do that, you got really good odds of staying healthy long into old age. Anyways, hope you found that helpful.